We kind of think of medicine as being pretty predictable, right? You take one pill, you get a certain effect. So you take two, you should get double the effect. But what if that's not always true? What if I told you that for some really common drugs, your body just completely throws that rulebook out the window? What happens when the whole system gets overwhelmed and things get, well, complicated? And that's really the big question we're tackling. We just assume this simple straight line relationship. One pill equals a certain amount of relief. So two pills should equal double that relief, right? Well, as it turns out, not always. And that little question mark there, that's pretty much the whole reason we're digging into this today. Okay, so before we can really get into the weird exceptions, we first have to understand the rule. So let's just quickly cover how most medications are supposed to work in our bodies, which thankfully is usually super predictable. So, this is what we call the normal world of pharmacology. It's got a fancy name, linear pharmacokinetics, but honestly, it's just a complex term for a really simple idea. It just means that all the processes your body uses to absorb, distribute, and get rid of a drug, well, they all work in direct proportion to the dose you take. Double the dose, you get double the concentration in your blood. Simple one-to-one relationship. And this graph shows it perfectly. Just look at that straight line, curve C. As the dose goes up along the bottom, the total exposure to the drug, what scientists call the area under the curve, it just goes up in this perfectly predictable straight line. It's clean, it's simple. This is exactly what doctors expect to see with most medications. But then you have the rule breakers. There are certain drugs where, as you start to increase the dose, they start to behave in really strange, really unpredictable ways. And this is where things get not just interesting, but also potentially a little bit risky. And this is the official name for the problem we're talking about: nonlinear or dose-dependent pharmacokinetics. The most important part of that phrase is dose-dependent. It means exactly what it sounds like. The rules for how your body handles the drug literally change depending on the size of the dose. Okay, now check this out. Look at curve A. This shows you what happens to the drug concentration in your blood over time after a high dose of one of these tricky nonlinear drugs. See how it starts off really flat at the beginning? That means the drug is being eliminated super slowly. But then, as the concentration drops a bit, whoosh, it suddenly starts getting cleared out much, much faster. That is not normal. So that leads us to the big question, right? Why? What is actually happening inside our bodies that makes the whole drug processing system suddenly change gears like that, all based on how much we took? Well, the answer comes down to a really simple but super important concept. Our bodies have limits. Think about it like a bottleneck in traffic. Actually, you know what? That traffic analogy is so perfect, let's just run with it. All right, so let's break this down. Your body uses these little helpers, mostly enzymes and transporters, to process and clear out drugs. So I want you to picture these helpers as toll booths on a highway. Now, if you take a low dose, it's like just a few cars cruising through. Traffic flows freely, no problem. But if you take a high dose, it's suddenly rush hour. Cars are backed up for miles. Every single toll booth is overwhelmed. You've got a massive traffic jam. And that metabolic traffic jam, that's what we call saturation. And that's the official definition right there. Saturation is simply the point where the body's systems for processing a drug are just completely overwhelmed. They're maxed out, working as fast as they possibly can, and they literally cannot work any faster. And this metabolic speed limit has a scientific name. It's called Vmax. The V is for velocity, max for maximum. It's the absolute top speed your body can hit to eliminate that drug. Once you reach Vmax, that's it. You've hit a wall. Okay, so we have our analogy, the metabolic traffic jam at the toll plaza. It's a great way to think about it. But what does that traffic jam actually look like when we look at the real data? Let's check out the visual evidence. So what you're seeing here are the two big consequences of saturation. On the left, there's that flat curve again. The drug is just hanging around for way longer because the system is overwhelmed. But look at the graph on the right. See how curve A just rockets upward? A small bump in the dose leads to a huge, disproportionate spike in how much drug your body's actually seeing. This is our traffic jam shown in data. It is definitely not a straight line anymore. It's a dangerous curve. So let's just quickly recap the hallmarks of these nonlinear drugs. First, their elimination isn't a simple, constant thing. The half-life, how long it takes for half the drug to leave your system, actually changes as the dose goes up. The total drug exposure, or AUC, is way out of proportion with the dose. And the big one,
Even small changes in the dose can lead to these massive, unexpected jumps in blood concentration. And yeah, other drugs can even compete for those same toll booths, making things even more complicated. So you might be thinking, okay, this is some interesting biology, but why does it actually matter? Well, it has huge real-world consequences for how doctors prescribe certain medications and honestly for patient safety.
And we're not talking about some rare, obscure medications here. You'd be surprised. We're talking about things like phenytoin, an anti-seizure medication, high-dose aspirin, and even alcohol. That's right. The way your body processes one drink is fundamentally different from how it processes, say, 5 drinks. And it's all because of this saturation effect. And this quote really says it all. Drug concentrations in the blood can increase rapidly once an elimination process is saturated. Notice the word rapidly. We're not talking about a slow creep. We're talking about a sudden, dangerous spike. And that's really the crucial takeaway here. For these kinds of drugs, a doctor can't just casually say, oh, let's just double the dose and see what happens. A tiny, seemingly safe increase might be the exact thing that pushes the body past its saturation point, and that can lead to unexpected and even dangerous toxicity. It's exactly why these drugs require such careful, close monitoring. So when you boil it all down, the big idea is this. Your body isn't just some simple container where you pour things in. It's a dynamic, incredibly complex system that has very real limits. And it really makes you wonder, doesn't it? What other biological bottlenecks like this are quietly affecting our health every single day?